We are trying to wind up with the Global Health Series, life expectancy country by country. And today we are doing number 171 to 180. Tavula has a life expectancy of 65.81. It is number 171 among countries. Ghana, which is number 172 among countries in the world, has a life expectancy of 65.75. Bhutan is number 173 among nations and has a life expectancy of 65.70. Madagascar is number 174 and has a life expectancy of 65.20. Number 175 among countries is Yemen, and it has a life expectancy of 64.83. 176 among countries is Gambia. Gambia has a life expectancy of 64.36. Sao Tome has a life expectancy of 64.22 and is number 177 among countries. Togo is number 178 among countries in the world, and Togo has a life expectancy of 64.06. Cambodia has a life expectancy of 63.78 and is number 179. Number 180, which is the last for today, is Kenya. Kenya has a life expectancy of 63.52. We still talk about social determinants of health because these are the things that contribute to either the longevity of why people live so long or live so short. One of them is global warming. Global warming is real, no matter how you debate it. A lot of places are falling, a lot of tornadoes, a lot of hurricanes. So many things are contributing to global warming, and policymakers need to channel that part of policy and see what they can do. Snow is not in most of the countries. Snow in some of the countries. In the US, you have snow. In Africa, you don't have any snow. But that's not a guarantee why people should not work hard. Because people still live up to 80 years, even in the US, even with the snow. Another social determinant is the wet season and the dry season. Wet season and dry season over there in Africa, but here you have even more multiple seasons, like the fall, the snow, then the summer and the rest of them. Yet, how you make use of these seasons contribute to how long you live on earth. Then food in various forms. Of course, in developed countries, most of them, like in America, you have a lot of food. And this food is wasted in stores, wasted in homes. They can't transfer it to areas like Niger Republic, areas like Chad, or people living in the deserts who don't have enough food. So while those people are suffering from malnutrition and dying faster, people over here are suffering from obesity and develop all kinds of diseases, diabetes and the rest of them. Number 6 is planning your diet. It's very important that we plan what we eat. You don't put all junks into your body. When you eat food that is not planned, no good diet, there is tendency to develop obesity. And obesity has a lot of problems because when we talk of kidney failure, we talk of heart failure, we talk of diabetes and the rest of them. The contributory factor is obesity, so that's why we should plan what we eat. Then physical exercises too is very necessary. If you have the opportunity, even if you are dancing in your room or walking, do a kind of physical exercise if you want to live a little longer. Apart from physical exercises, you have health disparity. You have the poor ones, you have the rich ones, and some people suffer without having access to medical care. Where there is disparity in a country, of course, people die faster if they have no access to medical care. Then access to care is number 9. In most of these countries, I've read Tavula, Ghana, Bhutan, Madagascar, Yemen, a lot of people don't have access to medical care, and that is why they have to live lesser years compared to people in some other countries. While somebody in Monaco is living for 86 years, 89 years, somebody in Togo is dying at 64. So something has to be done when it comes to access to care. And of course, the culture also has an impact on healthcare and healthcare delivery. These are things and social determinants which even medical doctors or public health officials need to understand in countries in order to help people to live longer. We will end it there today and pick up from this place. I'm Professor Silvanus Okeke. Thank you and have a great day.